Hi there, my name is Terry Scott and I am a nurse practitioner and a registered nurse delegator in the state of Washington. I help provide nurse delegation services to your building. I'm very pleased to be putting together a set of short informational videos to help keep all of the medtechs and caregivers on the same page. Remember that these are educational content only. They are not meant to be provision of diagnoses, treatment, or medical care. If you have any concerns with the resident, you are better off calling 911 and getting immediate help to protect that resident's safety. This particular short training will cover normal vital sign ranges for older adults ages 60 to 95 and explains which results might need to be reported right away to your supervisor or your nurse delegator. Vital signs are more than simple measurements. They can tell us a picture of the patient and whether or not things are changing. They're immediate information on how the body systems are working. Some residents have their vital signs checked frequently because of comorbidities, and other residents may only have them checked once a month. This is all based on provider recommendation and orders. Please, when you take a set of vital signs, look at the numbers and recognize what they may represent so that you can intervene early should there be need. Let's start with normal temperature. Typically this is measured orally, and the normal range for an older adult would be about 96.5 to 99.5 degrees Fahrenheit. Older people may often have fewer fat stores and not be able to hold on to temperature quite as easily, which may equate to the reason why they have extra blankets on their bed or keep their room temperature very high. We need you to report a temperature which is above 99.9 or below 96, or if the resident just seems off, if they report being very hot, feeling very chilled, shaky, or confused. High temperatures can be an early sign of infection, and low temperatures in seniors can be equally as dangerous, but we don't want to rely on temperature alone. Let's check the other vital signs. A normal resting pulse rate is typically 60 to 100 beats per minute. I would like you to report anything outside of that range, particularly if it is outside of their normal range. If you find a new irregularity, or if they are skipping pulse beats, particularly if the resident reports dizziness, weakness, or shortness of breath. This may mean that the heart is under stress and not providing the oxygen that vital systems need. A normal respiration or breathing rate is typically 12 to 20 breaths per minute. Reporting a rate below 12 or above 24 is significant, particularly if the breathing looks labored or is noisy, or if there are long pauses in between breaths. This can be a sign that the body is not going to get enough oxygen to support its needs. Blood pressure in an older adult is generally 120 over 80, but as people age, their arteries become less elastic, and so it doesn't have the flex that it once did. Any reading above 180 over 120 is considered a medical emergency and warrants 911 immediately. A low reading of below 90 over 60 can also be significant, particularly if it's accompanied by dizziness or any large change from the patient's usual behaviors or numbers. A normal oxygen saturation is felt to be 90 to 100%. This is the amount of oxygen that is attached to the red blood cell, typically at the tip of the finger where we measure it. Pulse oximeter readings may not be accurate if a resident has nail polish on, so keep that in mind. Please report any reading below 90%, particularly if it is sustained below 88%, even after you've asked that resident to take a few nice deep breaths, slow and easy. If they have blue or gray lips, have cold fingertips, or significant confusion, shortness of breath, low oxygen can become an emergency very fast. And here's a quick recap of every normal range and what to report. But please remember the golden rule. You do not need to diagnose anything. You just need to notice a change and tell your supervisor or nurse delegator right away. Always follow your agency's specific policy for exact reporting steps. I hope that you have felt that this information is helpful. Please again recall this is not medical advice. For any significant concern, call 911 and report help immediately.